Hello, and how are you doing? I'm Dr. Brou, a board-certified plastic surgeon here in Oklahoma City. And this is going to be our second installment of a podcast. And this time the subject is going to be tummy tucks. It's a favorite subject here in my practice. I do a lot of tummy tucks and I have lots of questions. And here is Nicole, my patient care coordinator. She's the one that handles most of the inquiries about this operation. So we're going to have a nice conversation about it. Sort of like the things that we would talk to you if you come to see me as a patient.
Absolutely. Yes, like you said, I'm his patient care coordinator. So I'm usually talking to most of you guys on the phone. There's definitely a lot of common asked questions. So we're going to go over them today and hopefully it provides a little bit of clarity for you guys. So like you had mentioned, tummy tucks is going to be the topic of conversation.
Yes.
Oftentimes when women call, they will ask, do I need a full or do I need a half tummy tuck? Is that something that you hear often as well?
That's very common. And so there is a standard tummy tuck and then there is the mini tummy tuck. And anything that is not a standard tummy tuck could be a mini tummy tuck. And traditionally, this operation, a mini tummy tuck, was done in people that only have problems in the lower half of the abdomen. Okay. So you can do a limited scar and remove that if there's nothing that needs to be done in the upper part.
Okay.
But that is really not a very common thing in my practice because oftentimes the patients that come to see me have a lot of issues with the skin above and below the belly button, so we need to address that with a full tummy tuck.
Okay, good deal. I know this is a very common procedure post having children, of course, or if somebody has lost a tremendous amount of weight, then there's that skin laxity.
Is that what correct. You're saying? That is correct, yes. And most of the patients I get are patients that are women that have had children. They're done having children. They lost weight and they wanted to improve the contour of their belly and torso. Of course. And, most of those people after pregnancies, their muscles stretch out to a point where they can't really control that contour of the tummy.
Right.
And so they bulge, and the best way to fix that is by repairing the muscle. So we're going to talk about that a little later.
Okay, so that's not all of our patients then. So not all of our patients need muscle wall repair.
I say the great majority of them do.
Okay.
And so I even do tummy tucks on males.
Okay.
And generally males have lost a lot of weight.
Okay.
And they have that redundancy of skin that they want to take care of. You would think that males don't need the muscle repair, but sometimes they do. And even in the males, sometimes we do muscle repair, but in general, in males, we don't. We address mostly the extra skin.
Okay. Is that something that a lot of practices do? They help both men and women when it comes to tummy tucks?
I'm sure. I mean, we don't discriminate based on gender. So I do have probably 10 to 1, 10 female patients to 1 male patient. And generally, the male patients are patients that have lost a lot of weight and they have a lot of extra skin to deal with, yes.
Yeah, and I think it's important to bring that up just because we are so popular amongst our women patients, but men are welcome as well. Can you talk to us a little bit about what to expect with scarring?
When I do a tummy tuck, I try to position my scar as low as possible, right above the pubic area, like the pubic mons. Because I want the patients to be able to wear a two-piece and not show any scar.
Okay.
And the other thing I do is I tend to lift the pubic area because sometimes after weight gain, weight loss, the pubic area becomes very lax and with a lot of extra skin. And so I lift that up. And so we put those two things together, the skin in the upper part and the lower part, so it's nice and flush.
I imagine that's aesthetically pleasing.
Right, and that's the bottom line is that you want to achieve the most aesthetically pleasing result.
Of course. So what does recovery look like for these patients?
Yes, it's very important. Recovery takes approximately 2 weeks.
Okay.
And that's in somebody that the only thing we're doing is a tummy tuck.
Okay.
So patients, the worst week is the first week. I recommend sometimes people to get a walker so they can get around the first week. The second week, you're going to be able to walk straight and do most of your activities, but you're still going to feel some pain, and you're going to move slowly, and you're going to get tired quickly.
Okay.
But at the end of the second week, most people are ready to move on, get out of the house, do stuff, and feel more normal. Now, in terms of working out at the gym and things like that, you probably be safer waiting for weeks.
4 weeks?
Yes, and the trick is as you get back onto that routine, you want to start with the lightest weights and the lightest motions.
And build up.
So, yes, and build up from there. That's the key.
Okay. I know a lot of people that we know have spoken to us are moms. Like we said, this is, a tummy tuck that usually could play into a mommy makeover as well.
Yes.
If somebody has little ones around, we tell them not to lift the kiddos a couple weeks following as well, right?
Yes. So my rule is I don't want you to lift more than 10 pounds for 2 weeks.
Okay. Yeah. So we always encourage get some help with the kiddos if you can for at least those 2 weeks.
Mm-hmm.
Okay. So some more commonly asked questions. How about the garment? I know that they have to wear a garment post tummy tuck.
Oftentimes, we do liposuction along with a tummy tuck. It's almost a rule, but I also do liposuction in other areas. And therefore, the best thing for the healing of that is to wear a compression garment so you can squeeze out the swelling and also helps you contour the body and also offers you protection and security. So we encourage the use of garments, and we provide the first set of garments for our patients.
Okay. What are some common areas that you liposuction, maybe along with the tummy tuck?
Well, I like to look at the aesthetics of the torso as a whole thing. So oftentimes when people don't look at their backs in the mirror, but oftentimes there's fat accumulations in the back that if you deal with them, you're going to magnify the result for the front. And also I always try to enhance the waistline, which is one of the first things to go.
Yeah.
With liposuction and with tension on the closure, yes.
So it gives them that nice little silhouette shape.
You want to give them the best possible shape.
So we get asked a lot about drains as well. Do you use them? How long, if so? So what would you say to that, Dr. Brou?
That's a very good question. And I started doing no drain abdominoplasty about 4 years ago.
Nice.
And at first it was a little hard to work in, but I managed to figure out how to do it. So I generally use no drains in my tummy tucks, the great majority of them. Now, occasionally there's situations where there's a lot of fluid from the liposuction, and I reserve the right to decide whether to put a drain or not in the operating room.
Okay.
But for the most part, I've managed to do the great majority of my tummy tucks without a drain. And what I do instead is I use some internal suturing that I call quilting sutures that we put inside to obliterate that dead space so you don't need to have a drain. And people do very well.
That's incredible. Because I mean, I know people that have gone to other locations, or you hear the stories about people going out of the country. You always hear some kind of horror story with drains.
With drains, right?
Yeah.
Well, I think that people still do use drains here locally.
Yeah.
I mean, and it's kind of like a safety valve.
Yeah.
But I find it unnecessary. But when I do a lot of liposuction in the back, sometimes I use drains if we need to. And they only stay for a day or two. They don't need to stay very long. But that's a big concern for patients because they fear those drains like you wouldn't believe, yes.
Yeah.
And so I reassure them that we can do the great majority of tummy tucks without drains.
Very nice. So With all the questions that were asked, who do you feel like is the best candidate, whether that be age or, like we said, fat loss,
Yes.
at post-baby? Who is the best candidate for a tummy tuck?
Yeah, so in general, my tummy tuck patients are between the ages of 30 and 50. I think that, the younger you are, the better you're going to bounce back. The other thing is that ideally, I want you to be in your ideal body weight.
Okay.
But to be honest with you, some of my patients that have done tummy tucks, they've gone on to lose weight and go to the gym and work hard, and they make my results better. So you can improve on it by losing weight. And very important is nutrition. Make sure that, because patients that are losing weight, especially the ones on the GLP-1 medications, sometimes they're not very well nourished. So we have to work with them to get this protein load on them so they can heal quicker and without complications.
That's a big part of it. I know that I always speak to patients on the phone about BMI, that body mass index, specifically for health and that aesthetic result that you're trying to achieve.
Right. And regarding the BMI, sometimes people are on the heavier side. And the truth is that the heavier you are, the less I can do for you. And sometimes, when they're a little past a certain level, it's not very rewarding to do all this much surgery for that little result. But somebody with a BMI below 31 is considered a good candidate.
Okay, wonderful. Do you feel like there's any misconceptions when it comes to tummy tucks?
There's all kinds of misconceptions in plastic surgery. That's a given.
Yeah.
People, there's a lot of superstitious behavior in tummy tucks. One that I find very commonly is people that had tummy tucks elsewhere. They tend to put a button or a spacer in the belly button so it won't close. I've never had that problem. My belly buttons are small, but they don't close on their own because I suture them carefully. And so I think that's what does the trick of being small, being in the right place, and healing properly.
That's one thing I hear a lot from your patients that you've worked with already, is he does amazing belly buttons. You should see my belly button. It's so incredible.
That's my signature.
That's when you know Dr. Brou's gotten a hold of you, when you have that perfect belly button.
Yes.
So I wanted to dive in a little bit in regards to muscle repair when it comes to our tummy tuck or abdominoplasty.
Yes.
A lot of people are nervous when it comes to muscle repair or apprehensive. Can you educate us a little bit more on that?
Yeah, absolutely. So what happens is, and this is really the main reason why you do a tummy tuck, is when the abdominal muscles separate. And that happens because of pregnancies mostly. And so what happens is when they separate, that membrane in between gets to be lax, and then the tummy bulges. And you can't correct that unless you tighten the muscles again. And so that is one of the things that gives you the most integrity in your abdominal wall. Yes, and it's a good idea to repair because I've seen that gives them better control of their muscles. And even some patients claim that their urine doesn't escape as much when their abdominal muscles are repaired.
Yeah.
And it's an added bonus. I mean, I don't offer that every time, but it's an added bonus. So people are afraid of the muscle repair because they think it hurts.
Yeah.
And it's true, it does hurt.
Yeah.
But the advantage or the benefit of repairing the muscle is tremendous, and also you would be neglecting an important part of the tummy tuck if you don't do it. And by the way, what I do about the pain is we use a long-lasting local anesthetic. So at the end of the repair, which is done with sutures, I inject the muscles. So that gives you about 36 hours of pain control, which is very nice after. Yeah, so not doing the muscle repair because of fear of pain is a mistake, because it's a very important part of the tummy tuck.
Do you have some people that are trying to opt out of that, or we don't provide that as an option?
We do, but it's rare that you don't need it. You know, like a week ago, I worked on a male that lost a lot of weight, and I knew that ahead of time because I had examined him. But he had a significant separation of the muscles, and by repairing that, I give him an extra support for the tummy. So it's a good idea to do it if it's needed. I've only not done it in patients that had never had children, for instance, and therefore never separated their muscles.
Well, I thank you, Dr. Brou, so much. I hope this clarifies a lot for our patients. And please call in. Please ask more questions if you have. We would love to meet with you in consultation, and Dr. Brou can speak to you more one-on-one.
Thank you very much.